Hello and welcome to today's conversation. And like we promised you, we are going to discuss the problem of acne or pimples, if you like. So while you're at it, please do tell us if you can hear me well. As usual, we want to know, can you hear us well? If you can hear me well, I'll be very grateful if you give me a signal or a comment or something. Like I said earlier, or like you saw in our poster, today we are discussing the problem of acne, pimples, and we are joined by a skin doctor or a dermatologist, if you like. This is a doctor who has spent years studying and specializing in the conditions of the skin. So we thought that we bring him back. Last time he was here with us, we were discussing the issues of stretch marks and things like that. And since he promised that every time we call on him, he will always come back, so we thought, why not? So without wasting much of your time, this evening I'm privileged and I'm greatly honored on behalf of the audience of this page to host none other than Dr. Marlon. Dr. Marlon, how are you, my good sir?
I'm very fine, Dr. Mujajati. How are you?
It's always a pleasure to see you, my brother.
Same, likewise.
How's Livingston?
Livingstone is hot,
I
but
can
it's
imagine.
okay. Hasn't
I can
started
imagine.
raining like the swimming pools you have in Lusaka.
Yes, here it's drenching,
Yeah.
my brother. It's raining, and it's quite something.
Mm.
We've had rains, including flooding, including
Yeah,
billboards falling on people's property. We've had it
that's
all.
unfortunate. Yeah.
Very sad, actually.
Hmm.
So, Dr. Malan, for the audience or part of the audience that has seen you before, you actually don't need an introduction. But you know how it is. Social media is very dynamic. Some followers come in, new ones, others unfollow the page. But I'm more interested in the ones who have just joined us. Others may not have seen you because they missed the last show. So, very quickly, could you just introduce yourself? Who is Dr. Marlan?
Well, Dr. Malan is a medical doctor, specialist medical doctor, uh, specialized in dermatology and venology. Basically, we deal with skin problems and also sexually transmitted infections or problems or concerns. Yes, I'm based in Livingstone, affiliated to Murungushi University and Livingstone University Teaching Hospital. The name has changed from Livingstone Central Hospital to a teaching university now because of the number of universities affiliated to it.
Right.
Yes,
I
that's
I
me.
am I'm also going to claim, doctor, that you are affiliated also with CarePick Specialist Clinic.
Yes, yes.
Right. So,
Mm.
very quickly, doctor, and the audience, allow us to thank our sponsor for this very exciting show or for this very interesting conversation. Our sponsor for today's discussion is CarePick Specialist Clinic, and we would like to thank management and the board of CarePick Specialist Clinic for allowing us or for affording us this opportunity to have this conversation around acne, and also for allowing us or affording us the opportunity to host Dr. Marlan. For those who may be wondering where CarePick is located on Omelo Mumba Road in Rhodes Park area of Lusaka. Very quickly, Dr. Marlan, acne or pimples, how common is this problem? But maybe before we go there, what are pimples or what is acne?
Pimples or acne. So the word pimple is basically a symptom that most people complain with. But acne is a condition. It's a common condition, actually, very common. I think almost everyone has suffered from it. Okay, it's a skin condition which causes a lot of discomfort, okay, disfigurement, scarring, okay, and has a negative psychosocial impact on those suffering from it. So clinically, okay, or the way we would make a diagnosis of pimples or acne, uh, patients or individuals who complain of white and blackheads. I'm trying to not to use more of scientific language. White and
Yes,
blackheads.
doctor.
That's what most
Please, thank
people.
you so much.
Yes.
Please try and dilute the language as much as possible. My audience is very lay. We are not among ourselves as healthcare practitioners or as scientists. And I'm very happy that you are
Yes.
conscious of that. And please, let's use as common language as possible. I know
As
sometimes certain
possible.
scientific words are difficult to reduce into common language. We will try as much as
Very
possible to
true.
do that. Yeah. So go ahead,
Uh-huh.
please. Doctor.
So, like I was saying, uh, most people will begin to notice small growth or pimples, what we commonly call pimples, and others will have what are known as blackheads or whiteheads. Okay,
Now, doctor,
and
at that
mm,
particular point, I need you to distinguish between a black head and a white head. What's the distinction? What's the difference?
so the distinction is the blackhead, they are all raised. One for a fact is that they are all raised, but for the blackheads, the opening, the head will be opening, the content in that follicle or the hair follicle, that pore would have been would have either dried or reacted to the environment and changed color or solidified, and they'll show that blackness. That's the reason we call them blackheads. But for the whiteheads, you find that the content, the oil, the sebum, which is produced by the body, is still encapsulated or is still covered. Okay, the opening is still closed, so you can actually see the actual uh, nature of the content whitish, like pussy like. So those are whiteheads. And the blackheads, you find that the content would have reacted to the environment, either air or bacteria has worked on it, and it's black. So for one to say that they have pimples, there should be at least the presence of whiteheads, blackheads, and those what we call papules or pustules. Yes.
What are pustules? Like for example, if my grandmother asks me, my son, what are pustules or papules? What example would you give to like describe them?
So pus, it's whitish, it's swelling and whatnot. So a pustule is just a swelling with a tip of pus on top. That's a
Right.
pustule.
Mm-hmm.
Then a papule is just a raised part of the skin, just a small, their sizes involved. So a, a papule to just be a raised, like a pimple, which is just raised. That one we
And there'll
call
be
it a
no,
papule.
and a papule doesn't
No
have
pus
a
in
bit of
it.
pus on it. Yeah,
It doesn't have. Okay.
I see.
Yes. Then
Okay.
a pustule, it will have pus.
Mm-hmm.
Yeah.
That
But
is, it
both
will
of
have the
them are raised.
appearance. So a pustule will have the appearance of pus on it, and to be raised.
Mm-hmm.
Whereas a
To
papule,
be
it
raised.
is raised quite all right, but it doesn't have the appearance of
But
pus
no
on it. That's what you're saying.
pus inside. Yes.
I see.
Yes.
Now,
Yes.
doctor, very quickly,
Mm-hmm.
very quickly, how common is acne? or pimples?
It's very common. Unfortunately, we have not done studies to determine how common acne is, but it's very common. I think almost everyone, okay, has suffered from acne at one point or the other. Okay, so it is very common.
Which brings me to the next question
Percentages.
then. Which
Mm,
brings me to the next question, doctor. What are the
yes,
causes? Like, who is vulnerable to, who is likely to develop acne or pimples? What are the causes?
what are the causes? So there well, we could say there are also factor aspects of genetic uh, predisposition. There are certain individuals you find that in their families they will have uh, the severe form of acne, or they will develop acne. Even their parents will say, "Look, when I was young, I had acne, but it phased out." Okay, so, or should I say now, the other causes, we could have hormonal imbalance. Okay, we could have dietary aspects where people are more into sugary things. Okay, sweets, chocolates. Okay, fatty foods. Okay, those ones could predispose one to getting acne. Stress.
Did you say chocolate, doctor?
Well, yes, it's sugary.
These ladies
Chocolate,
are not
yes.
going. These ladies are not going to like us if we say chocolate can predispose to acne. You
Well,
know how
too
ladies
much of
ladies like
everything.
chocolate, though.
What we are saying is they should not. They can still have chocolate, but we know there are people who stock chocolate like no man's business. When they go, buy maybe 6, 7 bars, and within 2 days, those are gone. Or chocolate sweets, okay, sugary juices, okay, junky foods, deep fried foods. Those will predispose one to um, acne. Okay, stress. Stress is another factor. Certain drugs, okay, like steroids. Steroids can give what we call steroid-induced acne. So there are some people when they start using steroids, okay, for whatever reason, either medical or for cosmetic purposes, they may develop uh, uh, pimples.
Okay, it looks like we have a challenge with contact with the doctor.
Internet.
Doctor, are you back? The network was a
I'm
bit
back.
slow there. Are you back,
Mm,
Doc?
I'm back.
We seem to have a bit of a glitch there. So you were saying that you were walking us through the causes of acne, or rather the risk factors. So please continue.
Mm. So stress, in stressful conditions, one produces a stress hormone called cortisol. So that's the reason why you would encourage our clients to handle their stress. Okay, others, when they begin to see a few pimples, they are stressed, they are worked out. Then tomorrow they see two more, worse more, three more. The next thing, it's a flare up of pimples and whatnot. Certain cosmetics which contain steroids, okay, to smoothen your skin, but with time it gives you a flare of um, uh, pimples. Even some drugs that we use for treating acne, some of them can actually give a very bad uh, thing, acne.
Right. Doctor, um, the pimples,
Yes.
doctor, or acne, are there
Yes.
types or are there stages or gradings of severity?
So, factors that we could use to grade severity, well, we can put acne in two types. Okay, there is the what we describe as the inflammatory one and the non-inflammatory one. The inflammatory one, they look like someone has got too much small abscesses and whatnot, and the face looks very angry, red. Okay, you have a pimple and it's red, especially in the light skin one. So that's two types. In terms of severity of acne, usually we look at several factors. Okay, how visible, okay, how prominent are the acne, okay, how inflamed are those papules, how many are they on that particular part of the body, how many, how how much do they have? Do they have pimples on more than one side area of the body? Is it only on the face? Is it on the back? Others, is it on the chest? Okay. The size also matters. Okay. So those are some of the factors that you look at. Okay. You look at, do these pimples leave scars? Okay. Once that pimple goes through its natural course, does it leave a scar on the patient? Okay. And also the we also consider the psychological impact on the patient. So those are the factors that you would want to say this acne in this individual um, is aggressive, or it's the severity of this acne is too much. However, in treating this acne, we have classified them in for easier management. You may need to classify them or define them in a particular way. So we have acne vulgaris, which is the commonest. Okay. Then we have the
All right, we seem to have a bit of a challenge with the network there. So, doctor, you were telling us about the way you classify acne based on how you treat it, and you mentioned acne vulgaris, and the network uh, gave a bit of a challenge. Yes, doctor, welcome back. You were talking about acne vulgaris.
yes. So acne vulgaris, it's the commonest. Almost everyone has suffered from it. Okay. Um, we also have the nodular cystic one, where someone who have more or less like they have blisters, cysts on the face. That one is really bad. Okay. And another severe form, the acne conglobate.
Right. We seem to still have a challenge with the network on Dr. Malan's end. Yes, doctor, you were talking about another type of acne. You said conglo what?
Conglobata
Conglobata.
of these are big words.
Yes, they are. Can we simplify them for the audience, please?
Hello? Well, The only way
So
I
how,
could describe
what
them,
does,
it's
okay,
if you
let's do this, doc. Let's do this.
Hmm.
Acne vulgaris, how does it differ from acne conglobata?
So acne vulgaris, one will just have the presence of those white blackheads and papules. Okay,
Yeah,
you see those small ones, but the nodular cystic or this acne conglobata, okay, who have cystic lesions, scarring, severe scarrings, okay, and more or less like someone has got micro abscesses, small abscesses, very big, okay, and that one normally heals with scarring. It's the severe form, it will heal with scars. You find that someone will have where the pimples where they'll have scars. These scars, and it may even form keloids, some individuals.
I see. Now, doctor, walk
Yes.
us
Uh-huh.
through the treatment. Now, one of the things that people complain about, even those people that we see in our clinic with regards to acne or pimples, is that the treatment takes too long. So, walk us through the different types of treatments, and also just some people complain that the some of the options they've been using they're not working because people use all kinds of things to try and treat acne. So, you are the expert. Tell us, is acne treatable to start with? And what are the treatment options?
So acne is treatable, very treatable. Okay. So one may need to understand how acne starts or develops. So usually acne starts from overproduction of um, sebum, the oil that our skins are usually oily. So in our skins we have these glands, the sebaceous glands. They produce this oil. Okay. Now that oil, together with the dead cells, may actually close these small pores or the hair follicles. And when they close that, okay, together with the bacteria on the skin, it causes that tumor raised thing. The production keeps on going, but due to overproduction, it closes that. Okay. So now, treatments usually would want to target all those avenues: the, the overproduction of oil, the helping in flaking, removing the excess dead cells. Okay, and also there are some bacterias, okay, skin bacterias, which promote the production of acne. So you'd also want to target that. So the main avenues of treatment are: one, uh, we have the topical ones where you could basically just apply on your face. Okay, a daily concoction you could apply on your face. Then there are also some drugs that you drink. Okay, now these drugs that you drink, they are those which could be hormonal, and others which are uh, which what term can I use? Well, their job is to change the configurations of the cells that that cause acne. Okay, so the other thing that we may need to explain to people, like you said, that most people say it takes long. There are certain medicines or procedures that you could do which have a quicker uh, outcome, okay, or response. But those ones, lasers, pills, certain pills, and whatnot, those ones, yes, depending on the concentration, yes, the the outcome is faster. Okay, but it also matters with the kind of acne that one has. Okay, so it's there's no one drug that could be used for all the patients. Okay, who need to make an assessment, know which kind of acne one has, and there should be a lot of counseling done, because someone should not have unrealistic realistic expectations, where you say, I don't want to see not even a single pimple. That is well, I can say not possible. We can make your face become smoother and uh, better than it was, but it's a team effort from your end as a patient and from our end, and having regular visits where we say, okay, look, right now we are from here and we are here, and at this point we should change our focus to ABCD. Okay, so that is in a nutshell. There are those whose acne is precipitated by an imbalance in hormone. So you may need to do a hormonal profile and see whether which one could be causing that, and try to balance that. Others, by controlling just their hormonal imbalance, everything falls in place. And in cases where you don't really find the actual cause, there are certain drugs that I've personally used, a bit pricey, but those my clients who've used it, they have had very good results. Okay, others within 3 weeks of taking the drugs, they'll begin to see the change. But others have gone as far as 3 months you're on the drug for you to see uh, positive change. And those who could have developed scars, post-inflammatory scars, or those black spots, there are also other chemical pills which are also used in treating and preventing acne. Okay, using the fruit acids. Okay, azelaic acids, the TCAs and whatnot, different percentages also. You look at someone's skin tone and whatnot, you select which one is better and you offer them that. So treatment of acne is not as what people tell you, buy this soap, use it every day, or apply this lotion. No, it should be individualized. There's no one product that can treat all kinds of acne. No.
Right, doctor. So what we're going to do now is that we will take questions from the people who are
Oh,
following this conversation. So we'll take questions for the next 15 minutes, and I hope we can squeeze in as many questions as possible in 15 minutes. I think you've done very well to introduce the topic, and you've touched on all the major areas. So let's see what questions our audience have. So, ladies and gentlemen, please go ahead and ask the skin doctor here questions. For those who have just joined us, we are discussing pimples or acne, if you like. So please go ahead and ask questions. Let's see. Okay, so Doc, someone is asking this question here. Cliff Siachibweka, please, where can I find this doctor?
Cliff, where are you found? I'm the doctor on the move. I can come where you are. So I'm in Livingston, but soon we'll be having clinics in Lusaka with the big doctor, Dr. Mjajati, plus other clinics who will be, once we agree when I could come and see clients from. So I'm in Livingston at the moment.
Right. So to answer your question, my brother, The good doctor here is in Livingston, but he can also see you from here at CarePick Specialist Clinic, so we can arrange. That's basically what the doctor is saying. But if you're in Livingston, please go to Livingston. Is it Livingston Teaching Hospital now, right? That's where you are.
Livingston University Teaching Hospital.
Livingston University Teaching Hospital. If you're in Livingston, that's where you'll find him. But you can also see him from here at CarePick Specialist Clinic if you need to see him. Right, let's see, which other question are we looking at? There was something quite interesting. Yeah, there's this one here about pseudocreme. I get this a lot, Doc. I need you to help us here. How good is pseudocreme for deep acne scars and inflamed acne? Pseudocreme.
So, pseudocreme basically is just a lotion which has been impregnated with vitamin E and other micronutrients. So, what it does, it just helps nourish the skin. Usually, we give it in people who have eczema, even those with burns or pressure sores. It helps rejuvenate or revitalize the skin. So yes, can be used, but the concentration of the active ingredients not so good. One of my hopes, Dr. Mjajati, is to have um, have these skin products that we could use that could be of benefit to our clients.
Right. Doctor.
Yes, Dr. Mjajat.
Yes, sir. I've noticed that you keep checking on your children. That's what babysitting does.
Yes, I was on the move, so I just had to pack and run away from the house.
So I've noticed that you keep checking on your children. This is how committed you are to us and the people, and we appreciate your commitment that you can be babysitting and still be able to attend to our questions. We appreciate your commitment, Doctor. So, Kate Peary has a question here. Is glutathione an acne treatment?
It's not an acne treatment. Usually it's used for skin rejuvenation. Okay, it helps rejuvenate the cells. So basically, yes, but it could improve the tone of your skin and whatnot. So for those people who would want to stay and look young, to glow, that's the one to use. But caution, overindulgence of anything has got its own side effects. So it's something that one may need to use under the guidance of the specialists.
Yeah. All right. There's another one here. Doctor, can you recommend vitamin C serum? I didn't know there was a serum for vitamin C. Can you recommend vitamin C serum for acne treatment?
No, just for skin rejuvenation and maintenance, but not for acne treatment. Acne has got specific drugs that could be used and recommended. Okay, most people, what I've realized is that they buy these things and they use and they use and they use and they use and never get better. No, you cannot use that for acne treatment. No.
Doctor, is aspirin safe for us for pimples, especially when they put it in a lotion? I didn't know that people can mix septrin they put septrin in the lotion to treat acne. Kindly provide guidance, doctor.
So septrin, I've used it for treatment of acne. So like I mentioned, there are two kinds of acne, the inflammatory one and the non-inflammatory one. The inflammatory one, mostly you find that there's bacterial involvement. So that one, yes, you may have an improvement with your acne. So it's not everyone who benefit from septrin. So there are those where you think, yes, there is bacterias actually induced this, and you put them on septrin or any other antibiotics like doxycycline or erythromycin for a longer duration. Yes, that has been shown to uh, help with acne. So now the other thing is that there are some people who react. Both you and me, Dr. Mjajati, we know that septrin is one of the causes of Stevenson Johnson syndrome. Okay, so some people who actually have abused that, they've suffered that drug reaction. So you need to get these drugs under the custodian, or the clinician should be there to advise in case of side effects or drug reactions. Can be used, yes, but with caution.
Right. So the take-home message is that yes, they can use septrin to treat pimples or acne, but they should do it under the supervision of their doctor.
Yes,
All right.
yes.
Doctor, there's a question here that I had for you. Let me see. Yeah, this one here. This one here. So, Ronida Munuma, her issue is that my skin is too oily, hence, she has too much acne. What can I use to cure my face?
So she may need one products which an exfoliator and a lotion which helps which which is effective for oily skins. Okay, but some of them, when you actually notice, you could use even isotretinoin, depending on the type of the acne that they have. It really helps. Oil is actually good for your skin. You don't need to have a dry skin. Okay, you need to keep your skin oily and moisturized. Okay, so oil is good, but at times people think they have too much oil, but in essence, it's just normal. Just that people have told them you are too oily, okay, and they take it that they are too oily. But oil is good for your skin.
Right.
Yeah.
Doctor, here's another very interesting question. This is from Esther Chilala. Um, is the use of benzoyl peroxide 5% safe for treatment of acne vulgaris? And is salicylic acid safe for use for dark spots?
Yes. So benzoyl peroxide, it's an exfoliator. It's safe. It's okay. So now the issue is that 5% is 5. Others are, they range from 2.5, 5, 10. So for 5, you may need to wash it off after a few minutes and whatnot, because it can easily burn your skin. Even salicylic acid is safe, and these two are used to revitalize the skin and also uh, remove the excess dead cells and oils. They are good, they can be used and safe. But also, like I mentioned, they need proper guidance, because some people have ended up burning their skin, especially the one around the face, the eyes. Yeah.
Right. So basically, these products can be used, but use them under the guidance or supervision of your doctor. That's what the doctor is saying
With your
here.
dog.
Please bear that in mind. Make sure that you are using them under the guidance and supervision of your doctor. Doctor, someone here is saying she read somewhere. We should be winding up in the next 5 minutes, I believe. Yes, in 5 minutes we should be winding up. Doc, I read something that washing your face with salt water can help in the reduction of pimples or acne. How true is it? Atufakaza out Mmanzi, Doc.
Dr. Mjajati, some of these things I'm just hearing them for the first time. So the issue is that people are desperate. People want to get well, but some of these things don't work. They don't work. No. Well, it's not
So, Chisanga,
conversion. I've never used it.
So, Chisanga, you've heard the doctor here, who is a skin doctor, has refused that you can't put salt on your face to treat acne. Now, there's this other one. It keeps popping up and popping up and popping up. I thought we address it. Doc, can Colgate, or rather any toothpaste, help in treating acne? I see you're laughing, Doc.
Dr. Mjajati.
Don't laugh.
Mjajati, if I say yes. Let's keep things for the teeth, Doesn't work. Doesn't work. If it works, it's by chance, but it doesn't work.
Right.
Doesn't work.
You know, this is precisely why we started this page, for this very reason, that people can be free to tell us what they think, and then we can clarify. And I'm glad you're here to clarify. Because you see, we started this page for this very purpose, so that people like Michael Gondwe can freely say what is in their hearts, and we can clarify for them. So, Michael, the doctor here is saying that toothpaste does not help in the treatment of pimples or acne, so please don't. All right? Somebody here wants to talk about... All right. There's a hormonal... Yeah, this one here. Okay, it's herbal. Anyway, I'm not sure how familiar you are with herbs, Doc. How effective is turmeric in the treatment of pimples or acne?
Well,
I think this is herbal medicine. Doc. Are you familiar with herbal medicine?
This is herbal. No, not yet. No.
All right. All right. Okay, this is our last question, Doc, so that we can close the day. Tashen is asking, what are some of the signs of hormonal acne and any natural or home remedies or easily accessible meds that can be taken to balance the hormones?
So the signs for hormonal are quite a lot. Well, should I say, it varies from person to person, but some of them may find that first the periods, okay, could be heavy or no absent periods, and some of them may actually realize that they have pimples during that period of the month when they're about to attend menses and whatnot. Others, you may find that the pimples persist way into adulthood, because the natural course of pimples is that when they start with time, they go down. Okay, but with those which are hormonal, you find that they persist. Okay, they do scans. Others may find that they have polycystic ovarian syndrome. Others may have challenges in conceiving. Others, they may also have other features. They hirsutism, which is basically a male pattern of hair growth. Okay, so those are some of them. And natural remedies, well, I cannot really advise on those things, but medicines, yes, they are already there. Okay, even these contraceptive pills can be used to treat uh, some kinds of acne, especially if you're suspecting that one has got pimples caused by hormonal problems. Okay, others have noticed that the time they started taking contraceptives, their skin just cleared. Okay, there are also some drugs that we use for heart failure. Spironolactone can be used for treating uh, hormone-induced acne, and also the famous drug isotretinoin can be used for almost all kinds of acne. Okay, but there are cautions that should be taken. Okay, one should not fall pregnant whilst on that drug, and in some cases it may look as if it's worsening, and if it does, uh, your doctor should be able to advise and handle those issues carefully. So for hormonal
Right.
thing, you may need to sit down with the patient, discuss, know what could be triggering those things and whatnot, address those things, and offer them a solution.
Doc, could you
Yes.
just switch on the lights in your car? You know the light kapa mwamba kaja kama moto kaja kayashe.
Yes, doc.
Tarika ukuona Doc. We are just seeing a figure.
Nakaya, but it's dim.
Yeah, it's okay. I hope it doesn't finish your battery. At least people can see that there's a human being.
Naona.
Yeah, but where you are right now, it's fine. It's okay. So let's take one last question so that
Okay.
Okay, there's this one here. The issue of normal saline is similar to the one who was asking about salt in water, right?
Yes.
Yeah, so we won't address that one.
Maybe we should do a study, Dr. Mjajati, on
and
salt
start
water.
giving people. We should try and expose and do the normal saline one and salt.
You
Okay,
may
if
just
we are willing volunteers, we can do a prospective study and see what happens. I mean, if people are experiencing interesting results with salt, what can we do? It's time to check it, maybe.
True, very true.
Doctor, this one here, I don't know whether you've experienced it yourself. Roma Beach. Hey, is that a real name? So she's talking about spironolactone.
Maybe it's the pronunciation.
Yeah, maybe it's the way I'm pronouncing it.
Yes.
Spironolactone combined with
doxy.
Doxy. Is it doxycycline?
Yes. So
you've
doxycycline,
experienced
yes.
this yourself? Does it work? Spironolactone plus doxy?
Yes.
It works?
Yes, it works.
Okay.
Doxycycline, there are those that they take orally. Even spironolactone can take orally, especially for those who are hormone induced, or if you suspect that it's hormone induced. Spironolactone does the trick, though the side effects of hyperkalemia. So it's something that they may need from time to time to do labs to just see that everything is in place. Yeah.
Hyperkalemia. Can't you give him a potassium losing tablet to balance off the hyperkalemia?
Yeah.
I'm now thinking like a physician. I'm sorry.
No, I know. But those are issues that that's the reason why that's the reason we don't encourage people to say, oh, my friend used this and let me use as well. So you may tip yourself in other medical conditions that may be difficult to salvage you from that. So
Yeah,
you're better off having.
Because you see, the moment I saw spironolactone, the first thing that came to my mind was, how do you manage the hyperkalemia? You know, like hyperkalemia is going to be a problem here, and you may end up with a cardiac arrest without knowing.
Yes. So how we do it is that you start them on spironolactone if it's hormonal, but within 2 weeks or so you push in isotretinoin, okay, and phase it out, the spironolactone. So yeah,
Right.
could
So,
be
and
done.
as usual, like we keep saying, drugs like spironolactone and doxycycline require a prescription from your doctor, and you
A
take such drugs
prescription.
with supervision of your doctor. Please, please, please do not take these drugs on your own by yourself. You will cause serious problems. Make sure that you have a doctor who has prescribed these drugs, and the doctor is actually monitoring these drugs and monitoring your response to treatment. Do not take these drugs any other way. I'm sure, Doc, you agree.
Yes, I agree. I agree.
Okay. Last closing question so that we can go home. Maybe we can go home. Okay, I need you to emphasize this because you touched on it, and then we can close. Someone is asking, what is the best treatment for itching acne?
Well, it may not be acne. It may be something else, or it may be as a result of the products that you are using to try and treat the acne. Okay, so we may need to review what you are using. Okay, or you may want you've been doing it all wrong, where you want to keep your skin dry. Okay, and dry skin at times may itch. So it could be anything, but usually acne doesn't itch.
Right.
Mm.
Right. So, Doc, let me thank you most sincerely for coming, and thanks for making the time. And for those that may have joined us late, please, you can rewind the video and play it. I'll leave the video on the platform. Play it again and again and again. If you have questions or you would like to see Dr. Malan, you can find him at Livingstone Teaching Hospital, or you can see him through CarePeak Specialist Clinic, whichever one you prefer. So, Doctor, your final closing remarks as we go home.
Next topic, I'll do it at work in the office. So that
not here where you're babysitting.
Yes. Yeah.
Right.
So right. So acne, I know it's a stressful condition. I'll say it again, stressful, and it disfigures in some people. Okay, and it may have serious psychosocial impact. Okay, but just know that we are here for you. It is treatable. Okay, it is treatable. There are options that could be used right now, and we can navigate through your acne problem together. Okay, so we are here for you.
Thanks, Doc, and do take care. And I know you are desperate to go back and continue looking after and babysitting. Please thank your children for us for sharing this precious moment that you're supposed to spend with them with us, and we are most grateful. Good night, doctor.
Good night, Dr.
So, ladies and gentlemen, there you have it. We were having this conversation with Dr. Malan, and the conversation was around pimples or acne. What we ask you to do right now is that click that share button. Please spread this message as much as possible, and let's make sure that everyone who needs to hear this message can hear it. So go ahead and click that button and click that share button so that as many people as possible can have this information. So we thank you, and like Dr. Malan has said, if we think of another topic where we need the input of a skin doctor, he is readily available to come and assist us to navigate it. Should you have any further questions, we can always invite him to come back and clarify some things. So do take care, and please click that share button and share this video. Good night.